You sit down in your living room, slide the cuff onto your arm, and press the button on your blood pressure monitor. It squeezes uncomfortably tight, releases, and flashes a number that instantly makes your chest feel heavy, 170/96. Within seconds, your heart rate accelerates. A wave of nervous heat washes over your face. You wonder if you should take another pill or go straight to the emergency room. What you do not realize in that terrifying moment is that your fear is actively making the situation worse. The panic you feel triggers your adrenal glands to dump a massive dose of cortisol and adrenaline directly into your bloodstream. Those stress hormones act like biological clamps, violently constricting your blood vessels. Your heart is now forced to pump blood through narrow, rigid pipes, which drives the pressure even higher. It is a biological feedback loop, and your aging nervous system has completely forgotten how to hit the brakes. Today, we are going to bypass the panic. We are going to look at the exact, science-backed biological overrides you can use right now, in your own kitchen, to force your arteries to dilate and drop your blood pressure immediately. To break a sudden blood pressure spike, you have to understand that you cannot just think your way out of it. You must use a physical or chemical intervention to force the blood vessels to open. The fastest chemical intervention you have in your house right now is sitting in your spice cabinet. It is cayenne pepper. While it sounds incredibly counterintuitive to consume something spicy when you are stressed, the biochemistry of cayenne pepper makes it one of the most potent, rapid-acting vasodilators on Earth. Cayenne pepper contains an active compound called capsaicin. When you mix half a teaspoon of organic cayenne pepper into a glass of warm water and drink it, the capsaicin immediately binds to specialized receptors in your mouth and your stomach called TRPV1 receptors. When these receptors are activated by the heat of the capsaicin, they send a shockwave signal to your central nervous system. Your brain instantly responds by releasing a massive cascade of a neuropeptide called calcitonin gene-related peptide, or CGRP. CGRP is one of the most powerful biological vasodilators ever discovered by medical science. The moment it floods into your bloodstream, it forces the smooth muscle tissue lining your arteries to violently relax. The rigid pipes open up. Within minutes of drinking the warm cayenne water, you will feel a physical flush of heat spread across your skin. That is not just the spice. That is the literal feeling of billions of microscopic capillary beds opening up simultaneously, expanding the total volume of your circulatory system and immediately draining the excess pressure away from your heart. While the capsaicin goes to work on your blood vessels, you must simultaneously address the electrical pacing of your heart. When your pressure is high, your sympathetic nervous system is in the driver's seat. You have to manually force the parasympathetic nervous system, the rest and digest mode, to take over. The biological switch for this system is the vagus nerve. Most people think you can only stimulate the vagus nerve through deep breathing, but there is a physical backdoor to this nerve located directly on the outside of your body. It is called the auricular branch of the vagus nerve, and it runs right through the cartilage of your ear. You can manually massage this nerve to instantly lower your heart rate. Take your right index finger and locate the tragus, which is the small, rigid flap of cartilage right in front of your ear canal. Place your finger just behind that flap, press firmly, and begin to make slow, deliberate, circular massaging motions. Do not rub the skin, move the actual cartilage. Massage this specific spot for 60 uninterrupted seconds, breathing normally. The physical friction on this branch of the vagus nerve sends an immediate, mechanical signal straight to your brainstem. The brainstem responds by secreting acetylcholine, the chemical brake pedal for your heart. You will literally feel your pulse begin to slow down and smooth out as the electrical signaling stabilizes, taking the mechanical pumping strain off your cardiovascular system. Once the heart rate begins to drop, we have to clear the biochemical exhaust fumes out of your bloodstream. When you are in a state of high blood pressure and anxiety, you subconsciously begin to breathe rapidly and shallowly into your upper chest. This shallow breathing traps massive amounts of carbon dioxide in the bottom of your lungs. High levels of carbon dioxide in the blood cause the blood to become slightly acidic, which irritates the arteries and forces them to stay constricted. To immediately dump this toxic gas and normalize the pH of your blood, you must execute a specific respiratory mechanic called the physiological sigh. The physiological sigh is completely different from normal deep breathing. It consists of a double inhale followed by a long, extended exhale. Sitting in a chair, take a deep breath in through your nose until your lungs feel completely full. Then, immediately take a second, sharp, short breath in through your nose to pack a tiny bit more air into the top of your lungs. That second, sharp inhale is the mechanical key. It physically pops open millions of microscopic air sacs in your lungs called alveoli that have collapsed due to your shallow, stressed breathing. Once the alveoli are popped open, part your lips and let out a long, slow, extended sigh through your mouth, making it last as long as you possibly can. When you do this double inhale and extended sigh just 3 to 5 times in a row, you massively offload the trapped carbon dioxide. The acidity in your blood neutralizes, the panic center in your brain is biologically forced to shut down, and the systemic arterial tension releases. Now we must address the localized tension in your limbs. When pressure spikes, the tiny blood vessels in your arms and legs clamp shut, forcing all the blood volume into the center of your chest, which overwhelms your heart. You have to force those peripheral vessels back open. You do this by shocking the endothelial lining of your blood vessels into producing a burst of nitric oxide. Nitric oxide is a gas manufactured inside your arteries that forces them to widen. To trigger this release instantly, without getting off the couch, grab a rolled-up hand towel. Hold it in your right hand and squeeze it with a firm, sustained grip, about 30% of your maximum strength. Hold that squeeze without letting go for exactly 2 minutes. During those 2 minutes, you are physically clamping down on the blood flow in your forearm. The muscle tissue becomes slightly starved for oxygen. The exact second you reach 2 minutes and completely release the towel, a tidal wave of blood violently rushes back into your arm. This high-velocity rush of blood aggressively rubs against the inner walls of your arteries, creating biological friction known as shear stress. The shear stress forces the endothelial cells to instantly dump nitric oxide directly into your bloodstream. The vessels in your arm massively dilate, acting like a release valve on a pressure cooker. Rest for 1 minute, switch the towel to your left hand, and squeeze for another 2 minutes. In just 5 minutes, you have used the muscles in your hands to manually pump natural blood pressure medicine directly into your circulatory system. You now have 4 immediate biological overrides to break the spike: the cayenne pepper flush to chemically dilate the vessels, the auricular vagus massage to mechanically slow the heart rate, the physiological sigh to offload acidic carbon dioxide, and the isometric towel squeeze to force a localized nitric oxide dump. If you execute these 4 steps consecutively, the sharp, terrifying spike on your monitor will break. But lowering the pressure in an emergency is only half the battle. If you do not immediately change the chemical environment of your bloodstream over the next 24 hours, the arteries will simply stiffen back up the moment the cayenne pepper wears off. This is the biological reality that standard medicine rarely explains. A sudden blood pressure spike is the ultimate sign that your cellular pumps have completely failed. Every single muscle cell in your arterial walls operates on a delicate balance of minerals. Calcium enters the cell to make the artery constrict. Magnesium enters the cell to push the calcium out, allowing the artery to relax. When you experience a massive spike, your cells are flooded with calcium, and you are profoundly deficient in magnesium. Your arteries are literally locked in a state of chemical spasm. To ensure the pressure stays down after you have broken the acute spike, you must flood your system with the biological key that unlocks the cellular door. That key is dietary magnesium. You cannot rely on a generic multivitamin for this. You need a massive, bioavailable dose of magnesium immediately. Walk into your kitchen and eat a heavy handful of raw, unroasted pumpkin seeds, or blend a massive handful of dark Swiss chard into a smoothie. Magnesium acts as nature's original calcium channel blocker. It physically intercepts the rogue calcium in your bloodstream, preventing it from entering the arterial walls. By consuming a therapeutic dose of food-based magnesium immediately after a spike, you are locking the vascular doors open. You are providing the structural support your arteries need to remain wide, flexible, and relaxed for the remainder of the day. Your cardiovascular system is an incredibly complex, resilient machine. It is designed to handle stress, but it requires the right biological inputs to reset itself. A sudden high reading on your blood pressure monitor is not a death sentence. It is simply an alarm bell signaling that your sympathetic nervous system is trapped in overdrive and your arterial cells are starving for the right minerals. Stop letting the panic dictate your biology. The next time the numbers flash dangerously high, put the monitor away. Walk to the kitchen, mix the warm water and cayenne, massage the cartilage of your ear, execute the physiological sigh, and grip the towel. Take manual control of your biology, force the system to reset, and then feed your arteries the magnesium they are begging for. This protocol is based strictly on deep clinical biomechanics, physiological reflexology, and advanced nutritional biochemistry. It is strictly for educational purposes and is never, under any circumstances, a replacement for the personalized care of your physician. Do not stop taking your prescribed medications, and if your sudden high blood pressure is accompanied by crushing chest pain, difficulty speaking, blurred vision, or numbness on one side of your body, bypass these tricks completely and seek emergency medical attention immediately, as those are signs of a severe cardiovascular event. Take exceptional care of your nervous system, learn how to operate the biological levers of your own body, and I will see you in the next video.